Hi, everyone. Welcome to the Becoming Anchored podcast. My name is Laura Deneen. I am one of your hosts today. The lovely Jacque is joining me for a wonderful episode that we actually have not talked on before. And so I'm really excited to have her. Thank you for tuning in to this show. If this is your first episode you are listening to, we really are about two different things on the show. So my co-host Lauren and I, we really just are about sharing our humanity with you all. And so just talking about some of the pain and some of the mental health struggles that we have been through. And so we are here just to really share our lives with you all. And then we also, secondly, talk a lot about the hopefulness and some of the experiences that we have gleaned over the years as mental health therapists. We really love our jobs. It's hard to call it a job, but I guess that's what it is. Our careers, our calling, what have you. It's just such important, sacred work. And Lauren and I have both been changed by going to therapy ourselves. And Jacque herself is a wonderful therapist, and so I'm super excited to learn from her today. Quick disclaimer, this is not meant to be your therapy, so if you are local to Tennessee, we would love to see you over here at Anchor, Jackie's Practice Curated Counseling. I'll definitely link that in the show notes as well, but she is amazing. I cannot recommend her enough. But if you're wanting therapy out of the state of Tennessee, I definitely recommend that you reach out to someone local to you. Okay, here we are. And we were chatting before we started recording about what we wanted to talk about today. And Jacque is an expert in so many different things. And I would really trust a family member with her in terms of just mental health therapy. But we decided on neurodivergence in women. And we felt that this was a really pertinent topic. And Jacque is certainly an expert in this area. So that's what we're going to be talking about today, y'all.
Yeah, I'm excited.
Okay, so first and foremost, I think if you haven't heard the term neurodivergence, Jacque, are you open to sharing a working definition of neurodivergence? I feel like that's the foundation for this episode.
Yeah, that's a really good point. So neurodivergence, I think, it's one of those things that's really getting thrown around right now, one of those buzzwords, kind of like boundaries or triggered, and people can really overuse it, misuse it. I think narcissist is another one of those that just gets, a bit in hyperbole. So this is a really good place to start. Neurodivergence is anything that is neurobiological, neurodevelopmental. So it is present at birth, in childhood, and then progresses throughout the lifetime. This is not something that all of a sudden in your teen years or early 20s, like with a mood disorder or like bipolar, that can just pop up, right? This is also one of those things where genetically, it's a genetics issue, right? And you can have really, really heavy genetics, that whole thing of genetics loads the gun, but environment pulls the trigger. And that can be more so for some of these disorders than for others. But that's the basic working definition.
Yeah. So what are examples of someone with a neurodivergent brain? Diagnostically, what would that look like?
Well, I guess it depends on which one. The two most popular things that we are really seeing right now, especially in our practices, and I think people are also seeing a lot online, specifically with women, is ADHD and Autism Spectrum Disorder. And so we can go into those a little bit more. But some other ones too, like we were just talking at the beginning of the show, is OCD is actually considered neurodivergent. And that one is a little bit different, right? Because you're not necessarily perhaps, but you're not necessarily as a 2-year-old, 3-year-old, 4-year-old going to see some of this stuff. You might see a little, right? Like with little kids that are just a little bit anxious, a little bit OCD, you might see some of the skin picking, hair pulling out eyelashes, but you're not going to see maybe some of the other more obvious telltale signs that will develop later on in adulthood, or even after big events, or even a big trauma in someone's life, boom, you're going to see that OCD. But there are always signs of it earlier on. So that one is a little bit different. Also, where you see sounds and hear colors, that one's a real fun one. That's included. But for ADHD in women specifically, one of the issues here of why we are noticing more and more women get diagnosed in adulthood or late teens is because women tend to be inattentive, whereas boys get caught, so to speak, a bit earlier. Because again, as a whole, just like broadly, this isn't, across the board, but as a whole, they tend to be more hyperactive. And that is really, really obvious in the classroom, right? Just inability to sit down, verbal outbursts in class, just meltdowns, right? Really like might get angry or cry, getting in fights on the playground, like things that are just really, really obvious. And you can tell it's a bit of an outlier from normal childhood development. So they're going to flag that to somebody and say, hey, why don't we have this assessed? Whereas girls really do tend to be more inattentive. And if they are hyperactive, usually we're going to see that more in their brain, right? So it's like a lot of like racing thoughts, or it could also be just hyperverbal, right? But they, from a social structure standpoint, really have much more incentive to adhere to the social norms and to the rules. This is associated a lot with good girl syndrome,
Hmm.
right? I don't know if you all have talked about that, like good girl syndrome. And also, too, the social structure of girls. And again, we're talking like in broad generics. I know that there can be, there are outliers and everybody's a little bit different. So we're just really talking with some broad strokes. But for girls, the social structure, there is deep, deep impact if you do not adhere to that. And if you are, in the RODBT sense, if you are kicked out of tribe, right, it's like a death. And so there's a lot of over control that then goes into like making sure that they fit within that social structure, to not tell secrets. That can be a big one, right? For girls. So it's like, they tell, it's like, oh, I'm going to tell you the secret. Don't tell anybody. But then it can be hard as a person with ADHD and impulsiveness and also just memory to not then go and blurt that out to someone else. If that happens, then that can be very, very, very painfully from a social perspective. And if you're then outcast, you learn very, very quickly, right? Do not do that again. So again, we start to see a lot more of that over control, which we can go into a little bit more later. The over coping, the over control leads to things like eating disorders, anxiety, perfectionism, because it is their way to then control themselves when they are undiagnosed for so long, right? And so by the time usually I get them, I see like this setup of usually a really high achiever, someone who's very perfectionistic, very driven, usually some type of presence of either disordered eating or eating disorder. And we're noticing all of that over controlled coping in an effort to manage the inattentive ADHD. So that's the broad overview for ADHD in women. Autism in women is also really, really interesting. People are talking more about this, and I can kind of hem and haw and see both sides of certain arguments here, because on one hand, the DSM is not updated, right? And testing for autism was normed only on white males. And so we are noticing not just women that are getting missed, but also people of color. And that also, I mean, it includes Black and brown boys, right? And we are seeing that they really just get shifted to the prison system to be incarcerated, or they're labeled with oppositional defiant disorder and conduct disorder and then antisocial. And maybe that did form over time, but only because they weren't properly diagnosed as a child. And so we're seeing it lead that way. And then with women, we're noticing, again, really high rates of eating disorder, typically misdiagnosed as bipolar or borderline personality disorder, OCD. OCD does co-occur really high with autism, but I have a little term that I like to use where it's like, is it autistic OCD or is it like real OCD? Right? Autistic OCD it's something where it's like a routine or a ritual that actually is self-soothing and helpful. It's not something that's interfering with someone's day in the same way that OCD might. But for women that are getting diagnosed later on, it's typically level 1. So with autism spectrum disorder, it's no longer Asperger's and autism, it's all one big spectrum, level 1, 2, 3. And for women, we see more of level 1, whereas the old statistic back in the day was like 1 in 3 boys is going to be diagnosed with autism. And that it's like in our minds what we think it looks like the very overt stimming, maybe rocking, hand flapping, nonverbal, intellectual disability, things that that's cemented, at least if you're a millennial, in our minds of what autism is. And really now what we're seeing with those stats is that if you're a male, you are more likely to be a level 2 or 3 person with autism. Whereas if you are a female, you're much more likely to be level 1.
Yeah.
And across the board, gender doesn't matter. If you're level 3, that's clear as day, regardless of what your gender looks like. But if you're level 1, you will really start to see the gender differences there.
Oh, I'm so grateful for your wisdom and expertise. And I love doing this podcast for so many different reasons. It's really life-giving for me. I mean, and I love like seeing friends and colleagues. And I also love like learning from the
Mm,
people that I've interviewed just to hear about the language they use. And I think the longer we practice, it can be really fruitful and it can almost like breathe life into our practice too of like, oh, okay, Jackie,
mm,
you like that language, that makes sense. But yeah, I think the first thing that I just want to highlight is like, for me, as you're talking, like some of the grief that has got to be there for your clients that have been
mm.
like that is so heavy. And it just feels important to highlight that first and
Yeah.
foremost of like how sad, how horrific, how even angry it makes me that so many women especially get missed for having these diagnoses that probably were present like you said, right? That these are things that we're born with
Mhm.
that are in our temperament, genetic makeup, and for how many years I can only imagine like the pain and suffering that's been there or maybe that's been like minimized by their friends or colleagues or other environments been in. And so that just feels important to highlight before we even get into like the minutia of like the diagnoses themselves, right? Like,
Yeah, no, I mean, spot on. I don't think, like, if I'm just kind of like running through the ticker of my caseload, I don't think I have had a single adult who, once they receive that diagnosis, that hasn't felt extreme grief, right? And really, truly, all like those 7 stages. Usually, by the time they get to me, it is like relief and acceptance of like, finally, this makes sense. And there's so much anger,
yeah,
right, as well, when we're looking at that grief of, I have been to X amount of therapists, psychologists, psychiatrists, right? How was I missed up until this point? And just like the anger that comes from that, because these people really, really, really struggle. The suicide rates for adults with autism, especially level 1, is really, really high. That chronic suicidality that's there, it's really painful, it's really high. And then to know, like, oh, this is what's been going on, like, nothing's actually wrong with me.
right.
My brain just works differently, and I'm being forced to live in a way that doesn't make sense for my brain, right? It can be very overwhelming, the grief, and I think that's a really good point that you made.
Yeah. And I think a lot of like, whether we're talking about like a clinical diagnosis or maybe even subclinical gets
Mhm,
missed for one reason or another. And I think like we are making progress as a culture, but there's still a lot of room for growth.
mhm,
Um, but yeah, that just felt really, really important to talk about. We talk about grief a lot on this podcast, interestingly enough. And that feels like some of the work I would imagine you are doing with your clients, even as they like kind of
mhm,
move back and forth through the grief stages of
mhm.
autism or an ADHD diagnosis. And I think too, such a picture of like, I know we've come a long ways and there's like still room to like grow and change as a culture, right? It's
Yeah.
like it is 2025 and women are being missed. And like, I don't, what do we do about it? Like, that's my
Mhm.
first like, question for you.
Right. Well, yeah. It's one, I think that we've just got to have better studies. There's a lot of really great stuff coming out of the UK, actually. I think just the way that their healthcare system works, they're able to run larger studies, right, that are empirically based, double blind, like all the stuff. They're able to just do that quicker than we are. And so they are able to come out with a lot of really great information ahead of the US. And so a lot of the times, myself and a lot of my colleagues were looking to some of those studies and reports to see what's going on. Like Tony Atwood is a big one, especially for girls and women with autism. He's got a lot of really great stuff on his website. Pathological demand avoidance is one of those qualifiers that the UK has already adopted, but we have not yet here. And if you are someone that works in the autism community, like we are already, it's like, I'll get reports like from a neuropsychologist, right, that does testing, and they're already giving qualifiers like with or without PDA, which I think is important, even though that's not right in our DSM yet. But it just goes to show like we need to do better about our studies and also acknowledging, again, it's not a one size fits all, but there are gender differences. You
Yeah.
know,
Yeah.
same as how, we didn't find out with Ambien until it was well on the market and women were driving but were asleep or like out, whatever. It's like, oh yeah, it's because their bodies metabolize this drug differently, but it was never tested on women, so they never knew that, right? Women are just missed in the medical field quite a bit, and there's a lot of different reasons for that. Not all of them are just nefarious, right? And I think that, as a medical and scientific community, we just need to do better in making sure that we're having clear data for what it looks like for women, what it looks like for men.
Yeah. So you and I can both like pull out a DSM today, right? And I know that this is available information to clients online or perhaps prospective clients for us. But I'm curious, like on a practical level, what do both ADHD and autism look like in women? Like what are signs that you're looking for in your clients?
So for ADHD, usually one of the first things is how they speak, right? Whereas if you were to ask someone who does not have ADHD a question, they might just be able to give it to you directly. Whereas someone with ADHD, they are not going to feel okay, so to speak, or like it makes sense to them to just give you the answer. They have to give you the whole workaround, right? It's like, well, I have to tell you this context and this, all the way around it just to be able to then land on the point, right? And so when someone communicates in that way, that's usually a pretty good tip off for me. Executive dysfunction is one, extreme overwhelm, right? Just chronic overwhelm, chronic fatigue, things that just can be brushed off easily and might be kind of funny, where it's like, oh, well, locked my keys in the door again, or, oh, I forgot this report, right? And it's like, oh, yeah, it's funny up until a point, and then it's not. It's like, yeah, like everyone, especially, at our age and stage, when you're a mom of young kids,
Yeah.
you are working and life is busy, like we all start to get that mom brain fog. Like that's normal, right? But when we start to notice what is like outside that realm of normalcy of, yeah, but you're actually like forgetting all of these things way more often than just like typical mom brain. That's another one. Getting chronically overstimulated. And again, these are things that happen to young mothers. You get overtouched and at some point you're just and lose it. That's normal. That happens to everybody. But then we're looking at the frequency, the intensity of how often is that happening to you, and also if we're looking at within that like realm of what we're just going to say is normal, right? What's your threshold of how quickly do you get overstimulated? And that's true for both ADHD and autism. There are some other things too where some forms of stimming exist for both autism and ADHD. Of course, stimming is inherent with autism, and with ADHD it might be a little bit more subtle, like like tapping your pencil, could be like moving your fingers. It could be even like if you're in class and you're just like picking at your cuticles,
Mm.
right? That's actually to help you focus, right? Because you're doing something else. So body focused repetitive behaviors, that's a big one for ADHD. So actually the nails, it's a pretty big one. If I see someone's nails that are just like all chewed up, that's usually their top stem. And then, other forms of executive dysfunction, those are really the primary ones that I see with women that are inattentive.
Yeah, like difficulty like paying bills, that's one that I've seen. Um,
Laundry.
laundry, yeah.
Hmm. Yep. Yep. It's hard for any working mom of young kids to stay on top of the laundry, have dinner cooked each night. And of course, like even splitting these things up with your partner, right?
Sure.
It's still like it's hard for anyone, but we get to the point where it becomes almost debilitating. Or you can do it, let's say Monday through Friday, but then by the time Friday comes, you are dead. Like you are done. You're not going to talk to anybody. You're not going to go out. You're like go into your cave. And that becomes like the way to manage, and it leads to extreme burnout. These are things that on one level can exist for a lot of people. But
Yeah.
again, we're looking at to what extent for those with ADHD.
I mean, yeah, like how life interfering. is what you're talking about. How quickly are you able to, I hate to say it this way, but bounce back, right? Like,
Yeah.
yeah. Yeah.
Let things go.
What are the main differences between ADHD and autism?
So it's interesting because, one of the things we were talking about too is like ADHD. A lot of high achieving, high IQ men and women, but just for the purpose of this, women have both ADHD and autism, which is another contributing factor to like how things get missed because one will seemingly cancel out the other, right? So autism loves consistency, structure, routine, rigidity, right? Knowing what to expect, having a certain way to do everything, like a system, right? Whereas ADHD hates that. It likes novelty. It likes to fly by the seat of your pants, right? It's much more just like whimsy and out there, more under controlled. Whereas with autism, we might see a little bit more over controlled. And so if someone who's identifies more as like, yeah, I'm kind of like the extroverted introvert, right? And it's like, tell me more about that. You'll start to maybe notice like that's what that blend looks like. And also too with autism, it is primarily a speech and language developmental disorder and social disorder, right? Those I think would be some of the primary components of it. And but again, remembering that that's a spectrum. So things like eye contact for people with autism, that can vary. So sometimes people might feel very comfortable looking at someone in the eye and speaking, whereas other times it might not be so much that they feel uncomfortable, but maybe they can't actually really focus how they need to if they're staring in someone's face because it feels just too intense. It's like that you might notice that when they're thinking, they're going to kind of look off to think and then they come back to it, right? So the eye contact in a social situation is big. Also, too, if someone, especially women who have been told, like, look me in the eye, it's rude to not look at me in the face, with someone that's new, they might be much more likely to look in that person's face or someone they're not as comfortable with. But with people that they are comfortable with, and so like friends, you might notice that they really do start to like turn off a little bit more and look off. So we have that in social situations. And then the language component too, it tends to be very, very literal. I saw a video the other day of this comedian who late in life diagnosed with autism, and it made a lot of sense to her. And so she was telling the story of when she was in grade school that they were learning about prepositions, and her teacher said, imagine that there is a box in the center of the room. And she's like, okay, yeah, I got it. Like there's a box. She's like, now I want you to imagine yourself in relation to the box. And then she just gets stuck. She's like, I'm related to the box, and then starts asking all of these questions each time. She was like, am I made of box? And the teacher's like, no, and getting upset with her because she thinks she's being a little cheeky, right? Trying to disrupt class, get some laughs, but she's being very serious. And the teacher becomes super frustrated and curses at her, throws her out, and tells her she's being very obtuse. And she said, up until this day, I had no idea why that happened until I was diagnosed with autism, right? So there are things that might, if someone's, autistic level one, they might seem a little naive or a little gullible. They take people at face value. They typically do not lie, even maybe when it would be kind to do so, right? Where it's like, does this outfit look good on me? They might be like, no. Right? So those are some subtler ways that we'll see autism, this social construct. And then with ADHD, we're going to see again more of that impulsivity of maybe they say something that they wouldn't have normally said, right? And it's like, oh, I really put my foot in my mouth. Like I should not have said that. They overcommit way, way, way more than the average bear. And again, I know that this also exists for codependency, but it's in the moment. It's like, oh, this seems really fun. Yeah, I'm going to do that. And then the day comes and they're like, mm-mm. These are just some more like subtle things that we see with women. And again, is the things that I'm talking about here are not specific diagnostic criteria. It's more of the nuance and the complexity that comes into this larger picture when we're looking about, again, a woman who is maybe high IQ, high achieving, and it's a little bit more difficult to pinpoint.
Yeah, no, I'm so glad that you're sharing these today because I think there's so much that is not written down in our diagnostic manual. And I'm all about like practicality, like I want our listeners to be able to pinpoint, okay, is this me? If maybe you're wondering whether you have ADHD or autism, and for the record, like, we're not diagnosing anyone on the show, we certainly
Right.
encourage you to like go see a professional. Or number two, like, experience validation. I would imagine that if you do have ADHD or autism or more ODHD, that you would experience validation listening to you talk, Jackie.
Yeah, I would hope so. And I know that I keep giving some of these qualifiers of most people do experience a lot of these things.
Yeah.
And so I don't want to make it where this broad generalization, especially some of the things that we see on like Instagram or TikTok,
Yeah.
which on one hand, I do think is actually really, really helpful for some people being like, whoa, wait a minute, that's not normal. Whoa, I'm every single one of these things.
Yeah.
Ugh, maybe I should get assessed. Like on one hand, I do think that social media is helpful for that. And at the same time, social contagion is real, right? And we might over attribute something or misattribute something to be like, oh, it's this, and maybe it's complex trauma. This is where that expert really, really matters because those things can overlap, look very similar. And so it's looking at how often do these things occur, how intensely, in what context. And to your point, where it's saying, like, hey, talk with your medical provider about these things. But the ADHD in particular can be interesting because the two parts really do compete. And there might be a day where you really notice, like, I am just struggle bussing with my executive function. My nervous system has gotten so overwhelmed that now it's starting to get hard to even like speak. That is a primary autistic issue, right? Where it's like that overwhelm, maybe from even the ADHD, right? That chronic overwhelm is really starting to get the nervous system up. And then one of the first things to go will be the ability to speak.
Yeah. Yeah. So interesting. I'm curious because we talk a lot about hope and accessing hopefulness on this podcast.
Mhm.
So, obviously, to our listeners today, right, whether you think you have autism or ADHD, or perhaps you have received a diagnosis, what helps? Like, where do you go with clients of yours?
Mhm. For a lot of them, I think receiving the diagnosis is actually really hopeful
Yeah.
because there's a name, there's a reason, there's a framework. And then outside of that, I think it's really, really important that we start to view things like ADHD and autism not from a deficits model, but actually from a strengths model, right? So, yes, these things are in the DSM, and yet it's not it's not the same as if like with depression, which also too when instilling hope with depression, I think that there are things that we can get from struggle, right? We learn and we grow in times of struggle. But we also don't want people to identify that their identity is their depression. That can become really damaging really quick. Whereas for someone with ADHD and autism, that actually is a part of who they are. And the acceptance of that is huge. So once we start to fully accept this is me, this is my brain, and there are a lot of really great things of having a neurodivergent brain, and there are some challenges. And so now that I can actually focus on where does this serve me? Where does this help me grow? How does this set me apart? The majority of CEOs are neurodivergent, right? Innovators, people, one of the great things about, especially, I mean, this is ADHD and autism, but maybe a little bit more with autism, is that you're not nearly as likely to be pulled into groupthink
Right.
just because everyone is saying, oh, we identify with this religion or this political view, and this is how we think. Even if they are in that group, if they don't agree with something, they are not just going to go along. They're going to say, actually, for this reason, I don't necessarily agree. And the amount of peer pressure doesn't matter. They're going to be like, nope, this feels very clear to me. So their value system can be really strong, which
Mm,
is excellent. And also, they're much more likely to push back against authority, which, is a good thing oftentimes. And they're able to think outside the box and be innovators. So there's a lot of really great things to point out to people when they are neurodivergent, that this is not a death sentence. This is not something that is bad or wrong. It is that your brain just literally works differently. And there are a lot of really good strengths here. And here's how to manage the things that are challenging that come along with it.
Right. Like, can we look at a referral for medication management if that's something that a client is open to? Can we look at working on some of the impulse control instead of immediately saying yes? How do we respond to an invitation for a social gap? Like, all these things, like, that I think
Mhm.
therapy can really support us in and can be really valuable, I would imagine, to clients of yours.
Yeah, absolutely. And even being able to, in the RODBT sense, like out yourself a little bit as appropriate. We don't want to overdo it or like wave, a diagnosis flag. But if you're sitting there talking with someone and you have ADHD, and then all of a sudden the train just leaves the station and you're literally just like, I completely forgot what I was talking about. And if that person tends to struggle with a lot of shame and anxiety, perhaps in the past they would have just like melted down and gone in the shame spiral and it would have been a whole thing, right? Whereas if you're working on something like that, then you use that as an opportunity to be like, whoops, sorry, ADHD, just like, woo, totally went out there, and use a bit of humor, and then you out yourself to an extent where it decreases the shame. It helps to explain what's going on, and then you don't get stuck and you can move through it.
Sure. Well, it's like a practice of like shared humanity. I think it's connection building, right? Versus like feeling so isolated in whatever diagnostic criteria um, we might have. Yeah, I love the strengths based approach that you use, right? Like, this is not something wrong with you. This is just, it's just different. And I think that allows for so much compassion to enter in. It's probably an antidote for a lot of your clients that struggle with like deep shame.
Yeah, absolutely. And also too, they are, you know, legally able to get accommodations should they need it. That, it's one of the things about how they've separated level 1, 2, and 3 is based on the level of accommodation needs, right? So
Mm-hmm.
level 1 is low supports needs. And this can be tricky because for those that are level 1, their supports needs are not necessarily going to be consistent day to day. Whereas if you have someone who is level 3 with intellectual disability, there are some of those that are going to be fixed. We know that there are going to be certain accommodations that will always be in place there. But something like needing to have maybe noise canceling headphones,
Yeah.
or if there are fluorescent lights at work, maybe to have like a dimmer over it, or in the airport, the ability to board first. Airports are really, really overstimulating. There are some great ways to help have some accommodations in place for those that are autistic where they're preventing burnout and meltdown. So those are other things that are really, really big deals. And knowing like, my best on this day, I might not need it. And yet there's another day where I might need this accommodation. That can really, really impact somebody's life.
Yeah. In a positive way, I would imagine, right?
Mm.
For somebody that maybe hasn't traveled ever and now, has this resource available and has the skills to ask for what they need. I mean, all the things that come from that rich therapeutic work that you're doing with clients. Beautiful.
Yeah. Thank you. And also another thing to look at for someone who's maybe struggled that is neurodivergent is the type of job that they have,
Yeah.
right? Usually this type of person might need to work from home or work for themselves, have, the ability to do different things each day, have maybe a service animal come to work with them. That's a really big piece too. People with autism, even level 1, oftentimes can struggle to keep a full-time job when there are not accommodations in place and when it is not a good fit for them.
Well, and I think it would be really normal for a lot of people to go into a deep place of shame and or guilt or internalized anger versus like recognizing like, oh, can this job accommodate my requests? And if not, can I look for something else? What else is available? I think it like opens up perspective too
Mhm.
in that regard.
Yeah. Well, and especially for, you know, the level 1 that we're, talking a little bit more about today, oftentimes those people do have very high IQ and they've been told their entire lives, like, you have so much potential. Like, you can do anything, you can be anything. And it's so much pressure. And those on the outside don't really know the internal struggle of what's also going on. And so there starts to be this chronic invalidation of, well, I should be able to do this. I should be able to do this.
Yeah.
Or someone else says to them, like, you don't look autistic, or like, no, you're not. Like my cousin's autistic. Like, you are not autistic,
Yeah.
right? Or you don't have ADHD. The rejection sensitivity dysphoria, which is another, thing that's starting to be more known with ADHD, is huge. The people pleasing, the perfectionism of like, okay, yeah, maybe I don't need to do that. I just need to make myself be
Mm,
able to do this. Yeah, maybe you can do that, but for how long and at what cost?
yeah.
And also too, for anybody that maybe is listening to this and is not neurodivergent, but has like a friend or a family member in their life who it's like, oh, I didn't realize like this is really impactful. It is a chronic, lifelong condition, both ADHD and autism. And there are, again, from the strengths perspective, I mean, some really great pathways for that. But when we're not diagnosed and when we're not effectively managing that, it can also be really, really heavy and hard to walk that path.
Yeah. Gosh, Jackie, you're just a wealth of knowledge. I know we had chatted about a couple of different topics before we started recording, so I would love to have you back just to chat about those at a later point in time. But I really appreciate your time today and your wisdom. Thank you so much for being here.
Yeah, thank you for having me.
Of course. Yeah. So, you know that we close with some homework and an affirmation. Would you like to provide one or both those pieces?
Hmm. For homework, I think that if you are a person who was born female and you are questioning whether you might have autism and or ADHD, go and check out Dr. Tony Atwood's website and take some of those screeners specifically. And that is not an official diagnosis, but that might be one of those things where, yeah, if you take a handful of those and it is saying like, you know, go have this checked out, then find a provider in your area who does specialize in autism and or ADHD, or even if you want to have the formal testing. A full battery psych eval is really expensive and not everybody can afford that, but there are a lot of really great psychologists, neuropsychologists that will just give you the ADHD test or just give you the autism screener, and they won't make you go through the full battery of testing. And so I would say if you're that person that's questioning, go take some of those screeners and go from there.
Thank you. Any affirmation that you'd like to provide our listeners with?
I really think just somewhere in the realm of just radical acceptance
Hmm.
of this is my brain, this is my body, my nervous system is sensitive. If you're neurodivergent, your nervous system is chronically activated, and that's okay, right? Just don't try to be something that you are not. Just full blown radically accept who you are already.
Mm. I love it so much. I'm taking that with me today. Yeah. How can our listeners find you?
CurityCounseling.com is probably the primary place. I do have an Instagram that I don't think I've updated in years. I need to, it's on my list. But you all could just go check me out there, give me a follow, maybe one of these days if I actually get around to, posting on there. My goal eventually, if I did do Instagram, would be a lot of helpful, informative things, but also things that are fun and funny, like a little bit of a mix. So give a follow there, and one of these days I'll get on top of that ball.
Jackie has a great sense of humor, so I can totally see that. Like you're so amazingly smart and you also like do such a good job balancing some of the heaviness of our jobs with the humor.
Mhm.
And I always have a good chuckle whenever I spend time with you. So I love it. I'm on board. I
Thank
would
you, Laura.
follow. Yeah. Well, thank you so much for being with us, Jackie. It was just a delight to just get to connect with you in this way. And thank you to our listeners. We'll see you next time. Take good care.